Again, great to have everybody on the call. It is Tuesday. This is now week 5. We are just super excited and just blessed just for the opportunity to provide these educational resources to our community. When we started this 5 weeks ago, those of you who have been with us since then, it was just a great call for all of us to come together to talk about some of the injustices that have been happening in our nation around COVID, around racism, around the digital divide, as students were asked to go home and take classes from home, knowing that many Black and Brown communities did not have access to internet or Wi-Fi or even a computer. And so now we find ourselves in this situation where we are doubly impacted by a pandemic of racism and then a pandemic of COVID-19. Our two guests tonight are experts in their own right. I do want to introduce them both just in the interest of time. And I want to get right into the questions. Thank you again, our guests, for joining us. Angela Claiborne is our first guest. She is the Chief Executive Officer of CARE St. Louis Health, has more than 37 years of healthcare experience. Ms. Claiborne has also been very passionate about the North St. Louis community. She started her journey in the healthcare movement as the registration clerk of People's Health Center, the director of revenue for Grace Hill Health Center, the chief financial officer for Hopewell Center, and Myrtle Hilliard Davis Comprehensive Health Centers, to the chief executive officer of St. Louis Health. Ms. Angela Claiborne, it's great to have you on the call tonight. Thank you for your sacrifice and for joining us. And also who's joining us tonight is my dear brother, my fraternity brother, Brother Darrell Hill. He's a graduate of Rutgers University and the Robert Wood Johnson Medical School, affectionately known as the University of Medicine and Dentistry of New Jersey. He completed further training at the University of Maryland Hospital in Baltimore, Maryland. He has been in practice since 1998. He has special interest in preventing health problems when possible and using appropriate testing when possible to identify health problems early. If possible, he believes natural treatment should always be used before medicine. Angela and Darrell, it is great to have you both on the call tonight. I do want to jump right into a few questions, but before I do, Angela, I want you to kind of start off the conversation with some breaking news related to COVID and related to the Black community. You and I were on the call earlier today, and I'm just excited that you're joining us tonight and be able to share maybe some of the news we have not heard yet related to COVID-19.
Okay. Hold on. Good. My husband telling me to smile. Okay. All right. Well, some of the news that I've heard, first of all, thank you for having me. I enjoy having a conversation that will enlighten individuals. As our conversations, we were talking this morning, I shared with you for me as a leader of a fairly qualified health center, our job is to test our community. At CARE Health, we serve over 25,000 unique individuals, and we provide a full panel of healthcare services. We have been providing COVID testing to North St. Louis ever since mid-May. For those of you all who may or may not know, the breaking news that really broke my heart was to find out that in St. Louis City, that 17 persons had died and they all were African Americans. And so I had to fight to receive services there, and they finally allowed the African American community to receive test kits to provide the test to the African American community. And so now the troubling news that we're facing today, even after all the hard work to convince African Americans to get tested, Quest Lab is one of the largest labs providing the test results to our community, and they have about a 7 or 8 day lag. So once you get your test, or you take the test, it takes about 7 to 8 days now to get the results, which is extremely too long. So now they have sent the message to my organization to not test asymptomatic persons, to only test those with symptoms. And so we know what that means is that a community that is currently devastated with the COVID-19 virus will have even more devastation face us. So that's the hot off the press news that I'm facing. And my executive team, we will definitely get together to try to figure out how to address this. But our organization, we're blessed, more blessed than some of the others. We do have a lab where we can provide test results for our community, which is something that we work very hard to do. But 8 days to get your results is huge for us. So that's hot off the press for me.
Okay.
Wow.
Yeah, that is good. And so, speaking about testing, and Brother Hill, you can chime in, and I want both you and Angela to kind of share what things that you have been working on more recently related to COVID-19. But are you finding, Daryl, that there are many African Americans who are not coming into the office to be tested? Right? I think there's this call for people to be tested now, and I think that at one point we couldn't get tested. Right. And so I don't know if the message has been sent out to the Black community in ways where we do know to come in. Talk a little bit about who you've been seeing. And it's different regionally. I think, Angela, when you and I were speaking earlier, you're not having that same luck in St. Louis. Can you talk about?
Oh, no, I agree with him. People can get tested. We are testing at probably, we had 24 testing sites, even providing mobile testing. And so right now in St. Louis and North St. Louis, that is not the issue, but people can. The issue, I don't think people know that they can. So for us at our health center, those that are aware, we do a lot of marketing. They come in, the churches want to, they have reached out to the health centers because they really want to open up their doors. School systems, as we know, that's a whole nother conversation we actually have, because that's a crisis within itself, is whether school should open or not. But I can tell you for daycares, we have been testing daycares. So those organizations have reached out to us to be tested. The dynamic that we're having, especially with asymptomatic individuals, is the delay, the 7 or 8 day delay here in our area. So for us at our health center, we started out with appointments, and it was about a 2 day delay. And so now we take walk-ins. Anybody can walk in and walk up to our site, get a test. One of the issues though, we're outside testing, and when we do mobile testing, we actually go inside of the facilities. But persons are very anxious when you get that swab up your nose. You want to know your results before 7 and 8 days. And so here in St. Louis and in Missouri, that's the delay for our labs. And so hopefully 2 weeks ago, we were about 4 to 5 days. So it's actually getting worse for us. So regionally it's different. Right now, the news for us in St. Louis, we had our highest peak today of 700 or plus persons who tested positive today. So it's just getting worse as we speak. So testing is important, but they can get tested. It's the results that's the issue.
The results,
Dr. Otley,
right? 7 to 8 days.
If I can add just 2 things. Number one, testing pricing shouldn't be a issue for anyone. So there are some people who might be concerned about pricing or having insurance. Technically, you don't need insurance to get tested. So that's number one. Number two, remember how this all played out. Initially, we didn't have any testing, and the FDA was pretty much allowing a lot of different companies to come up with tests. And over time, we're getting different types of testing machines available. Some will give a result in as much as 7 or 8 days, but there are some that can give a result within 24 hours, and more of them are in production. And as we mentioned earlier, they're regionalized as far as their availability. So as time goes on, we're seeing more and more testing options become available.
Yeah, let's talk a little bit about the fear of testing, right? I do hear you both mention that tests are available, and we'll get into a question in a minute about the messaging, the campaigns. Where are these campaigns landing in Black communities about testing being available? We'll touch on that in a second, but I do want to talk about, you did mention, tests coming back pretty quickly, but what about the fear of testing? I know that many Black Americans have shared fears about getting tested for STDs, right? And so when we think about just tests in general, is there this fear of, I may have it, oh, I think I'm good, I'm not showing any signs, and so we're not going? Are you finding, Angela and even Daryl, that the Black community is maybe fear this test?
Well, I can start and tell you this. Clearly, I'm seeing none of that. The people who want testing really want it for two reasons. Number one, or three reasons. Number one, they're symptomatic and they want to know so they can make decisions. Number two, some people are getting those exposures, pretty consistent exposures, and want to know. And number three, there are some people who are just anxious and want to test. So I'm not really seeing anybody who's afraid of this particular test, although I agree with you. Historically and with other testing, what you don't know, people are just comfortable with that. But this particular issue and the fatality associated with it, people are coming out to get it done.
Well, I'm seeing a lot of that. I think my task is different. I am, for us, we're testing persons that are required to have the test to go back to work. I have persons, and first let me just share something. Initially, when the testing happened, there was this long swab that probably persons lacked the experience on utilizing. And with our president saying that the swab touched it back to his eyeballs, so that feared, a lot of people were afraid of that.
Right.
But still, right now, today, I have fought so hard for North St. Louis to have access to health care. And persons have several reasons that they have shared with me. Some of them just don't want to know. So these are persons that are asymptomatic and that are afraid. Those persons come out and receive testing. But when your job mandates that you test, or when you have to get a test so that your child can stay in daycare, those are persons that are afraid to know the results, especially when you are my providers, staff. A lot of persons are afraid to get the test, especially African Americans, because they're essential workers, and this has a huge impact on their livelihood. When you say isolation and you are the nana with the house full of 6 or 7 kids and you test positive, you have to isolate, you have no idea what's going to happen with your children. So I have a totally different environment and exposure to what is happening. So for me, just trying to educate, first of all, make sure that they're safe with their results. And that's a whole nother issue that we have to deal with. What happens to the children when the breadwinner tests positive and there's no mom or dad in the house to sit with the children while this happened? So those are some of the issues. And if I take off work for 14 days, will I continue to get paid? And if you are the person who's the employer, I don't have the money to pay you if you're not here. And so all those issues is what I'm facing in our community. And they're real issues. And so for me, having that conversation and even hearing from the community, how do we have this conversation and how do we protect their results and not impact their livelihood? So I have a different role as a community health center and what I'm seeing in North St. Louis and what I have to address.
And so can you talk a bit more about protecting the results, right? Because the fear you just mentioned, and I'm glad you shared, because similar to Daryl, I'm in Prince George's County, one of the most affluent African-American counties in the nation. And so we don't always hear these stories, these community stories. So I'm glad you're sharing. How do you protect those who have been exposed to the virus but still need to return to work? What messaging are you giving those people?
First of all, they need to know. If they are infected with the virus, they need to know so that they don't pass that virus on to other persons. And I can just speak for me as a leader for the health center. All of the FQHCs in our area had laid off and cut persons' salary. And I literally had to pray and struggle that I would not do that. And to make sure that the persons that work for me, that they continue to have full pay. I'm competing with the unemployment and $600 on top of that. And so persons do not want to come in a health center and put themselves at risk. But for me, fighting for persons to keep their pay while they're in quarantine. And to make sure that they are safe. And that's a battle because on the other side, My husband, we're small business owners. He's a small business owner. So I understand when you don't have your worker or your employee there to help you generate revenue, and you're already in a climate where you've lost so much. It's just such a balance. But as you know, as we talk about this pandemic, how it's really hurting the African-American community, it's hurting us both ways. Most of us are essential workers, and we need our jobs. They need their jobs. They don't want their bosses to know, first of all, and then the shame with the disease. Let's just talk about that. Just being, people want to know, well, how did you get it? Did you not follow the law? Did you do something that you had no business? So just the shame that, oh, I have it. I don't know what I did wrong. I don't know what I touched. I don't, So that's a conversation we need to have and need to have some awareness to, because that's a huge issue, and people just don't want the results, so they don't have to be laid off. I received a phone call today. I can't mention the company, but 16 employees tested positive. They do not want their boss to know. These are real issues. That's a problem. And they African Americans. And so I said, you still need to get tested, but we can't share the results with their boss. That's up to them. And that's the company actually get a consent. But these are issues in North St. Louis, which is, very blighted, poor community. So and the flip side, I had a family that tested positive, and the grandmother tested positive, and she was the caregiver. And the grandmother did not want, and was very ill, and did not want to go to the hospital, afraid that she would put on a ventilator and that the children would end up in foster care. So neighborhood persons had to step up and help and stay silent and work with the social worker and all those things. So a lot of social issues. So I have a different perspective. I'm deep in the community with those social ills. And so that's some of the fear about getting tested and knowing your results. Unless you're really sick, where they go, and then that's too late.
And I'm glad you mentioned that, Angela. I think that you're sharing a lens that we don't get a chance to see or hear on the nightly news, right? And you're right in the community. So this is just very, very helpful for us to hear. And I want to ask you some more questions related to that later on in the episode. But Daryl, I want to come to you with this question. Angela really kind of raised this point here about the Black community being essential employees, being working on the front lines, many living in crowded housing, using public transportation, which increases their exposure to the virus. Our livelihood certainly must be maintained because of our family responsibilities. So Daryl, I'm interested in knowing what things can our community do on a daily basis, on a routine basis, to protect our families and to protect ourselves routinely, habitually, daily?
I think it's a great question. I think it's very important, number one, for us all to do what we're doing now. We got to be informed, we got to be educated, and then we got to talk about it. We got to understand part of the challenge now is just mixed information or misinformation. And as a result, that's leading to a lot of unnecessary illness. We know about the social distancing. We know about wearing a mask. We know about, hey, if you don't have to go to work, stay home. We know about if you have a kid in your home, teenager, a young adult who wants to go outside, you've got to have a conversation with that person. I have a young child, and I know no matter what I do, if they go out, when I say young, I mean 22, 21, when they go out, they're going to be with their friends and they're going to come back. And if they make the wrong decisions, I'm going to pay for it. And anytime we leave the house, we have to manage a certain amount of risk. There's going to be some risk unless you tell me you're going to stay in your house and you got enough food and supplies for the next year. Most of us don't have that. So that's what I would say. I would say we got to be educated. We got to be diligent. And then we have to be very patient. And we have to be very committed to the cause here. We can't do this for a week or two and then look for a break. So you see what's happening now with the 4th of July being here. People wanted to have the barbecues, the picnics, the beaches, and we're playing with a very serious virus here that will not discriminate. It will take human beings as they come or we come. So that's what I would say.
Yeah, Daryl, what else about the what things do you do routinely? I mean, is there a number of times you have in your head that you're washing your hands? Are you carrying sanitizer in every briefcase and lab coat? Like, I'm just wondering, like, on a routine basis, what things have you thought methodically through that maybe our community should also start thinking about?
Well, that's a good question. And I've had this conversation with my kids and my wife too. For me, I really try, and with my employees too, I really try to wash my hands every 2 or 3 hours easily. When I go out the house, wherever I get to, I wash my hands. When I'm getting into my car, getting out of my car, I have a sanitizer. When I'm in my office, I'm doing the same thing. I'm even taking temperatures on myself and my staff throughout the day. And very importantly, when you go to the grocery store and you bring groceries in the home, I might have been a little overzealous early on, wiping down groceries with sanitizers and other things, but I'm trying to be very methodical in how I manage all that. Wiping down commonly used areas in the house, like your refrigerator doors, your microwave, your stove, bathroom, same thing at the office too. And even making a decision at times, wearing gloves when I'm out in public, when I'm around the office, shopping, obviously no shaking of hands when you're out in public. I golf, so when I'm on the golf course, I might play by myself more often now. If I see somebody, you know, it's a wave or the 6 feet radius kind of thing. Because guess what? Life still goes on, and we have to realize that too. And you can imagine there are multiple other interactions throughout the day. Computer usage, how are you handling your computers? How are you handling your phone? Are you wiping your phone down? All those kind of things.
Yeah, I appreciate you mentioning that. Angela, same question. Curious to know what your routine has been for your personal life, your home with your family, but also with your employees. You do manage and you oversee tons of employees, and I'm sure there's probably some message by email or in person that you're letting your staff know about what things that they should be thinking about methodically.
Okay, well, for me, wearing my mask all the time, hand sanitizers, washing my hands. So I use hand sanitizer probably every 15 minutes to make sure that I'm safe. And also my chief medical officer, Dr. Harry, have insisted that I wear the plastic shield over my eyes because he done freaked me out about COVID going through, getting in your eyes. Mm-hmm. So while I'm at work, I wear the shield as well. For my employees, the same thing we insist is mandatory for all employees to wear their masks. We take the temperature when employees come inside the facility. We had to put the plastic shields to separate our employees from the public. And Dr. Hill and I were talking about how expensive these supplies are for us to stay in business. And I was sharing with him that a can of Lysol was $12. And we can think about that for ourselves, but that expense for everyone else. So the expense for businesses to even open to stay safe. So when I'm outside in the public, I am really freaking out, especially at the gas pump. Initially, I used to go and get gas to stay safe. And so I know this being recorded. So now I just send my husband to get the gas and hopefully he stays safe. I'm really nervous about the gas pump. So even though I use the gloves, do want to piggyback on something because there's controversy about this glove. Mm-hmm. So I've heard that wearing the gloves spread the virus versus not wearing the gloves and wash the hands. So Dr. Hill, let me hear your take on that. Because there's a great debate at our health center on what's safe, what's best when it comes to the gloves.
I think anytime you can separate your body from a potential virus, a glove is going to be advantageous. Like when I say glove, by the way, I wasn't talking about the typical healthcare glove. I will sometimes wear a work glove into a grocery store. Okay. But you know, at times I'll use a healthcare glove as well. And remember, when we talk about washing hands, most of us have got to remember the correct technique. We want to really make sure we're using soap and warm to hot water, and really taking about a good 5 minutes, 3 to 5 minutes to really rub down your hands. And really, we're talking about the entire fingers in the nooks and crannies. And remember too, washing of the hands is better than the sanitizer too. Sanitizer is better than nothing, but nothing beats washing your hands with soap and water. And I want to believe, keeping those hands clean, it's imperative, because over the course of a day, you're getting bacteria in your hands. And at some point, we all know we probably touch our faces too much. It transfers to your face, and that's a problem.
Yeah. Angela, you talked earlier about seeing it spike, certainly after the July 4th weekend. There's states that have been shut down again, right, Angela? And so do you and your staff, are you having conversations around, is this thing going to get worse? Has it peaked? Is it going to get better come the fall? I think so many people are wondering what to expect moving forward in the next couple of months. And I'm just curious if your medical officers or even your staff has had those conversations yet.
Oh, yes. We've had the conversations. Initially, we were not in the office as much. We had a separation of our teams. So for us, I have 4 locations, and I had restricted movement of employees from one facility to the next in case someone tested positive. We have had some of our employees test positive. And when we had exposure, we closed that health center down for following the CDC guidelines. But the city opened back up, and now we see the virus is spiking again. Mm-hmm. And so now we're trying to decide, should we have Team A and Team B? Telehealth really helped us survive this pandemic and treat our patients. Our patients, like Dr. Hill was alluding to, they're fighting to get back into the health center. They are sick. They have chronic diseases. And so telehealth can only do so much. And now we are looking at ways to actually use telehealth probably in a week and then come back in for a week, but continue the separation. And so those are some of the things that we're testing out. We don't want to have to close our sites again. We really was hoping that we wouldn't see a spike so soon. And prayerfully, if we can practice social distancing and not have so many patients in the health center and so many employees. So telehealth will help us balance that out and not close healthcare services to our community.
And you mentioned earlier, Angela, that, there are some folks who cannot telehealth and some folks who cannot work from home. And so is that the reason why the economy is so quick to open again? Because people need to get back to work, even at risk of more people becoming sick?
Yes. And even though we saw in the news on the package from the federal government, it really didn't hit everybody and didn't help everyone. So when we think of churches, as our place of worship and our faith-based resource. But church is a business. And so when we think about all the churches that are closed and the lack of resources, even though we shouldn't be thinking of them that way, they create jobs as well. So when for us, testing the churches so that those persons can get back to work. And they're praying that they haven't really opened back up, but that they will have the opportunity. The daycare is really hurting us. In order to have our employees come back to work, their children need to have a place to go. And initially, this was a great opportunity for us to open up our services and bring our providers back and our staff so that they can work in the health center. But once a child tests positive in the daycare, they close down the daycare. And this is a real issue for us. I've even had some employees who have cried that they don't want to lose their job. They don't want to have exposure to their children. This is a real issue on placing your children at risk in daycares and school systems just to make a living when you're talking about a virus such as this COVID virus. And so I don't have all the answers for that. I'm a woman of faith, and that's why I'm speaking out and reaching out to my community to hear some words for them and for us to come up with some action items. What can we do so that our community, even though we essential workers and we definitely on the front line, and but how do we keep our essential workers safe? How do we keep the Dr. Hill safe so that they can stay on the front line? We go in quarantine for 14 days. But if you take a doctor out, it takes years to become a doctor and a nurse. So how do we protect our community who is willing to treat the African American community? Those are some of the things that keep me up at night, and really, really, I'm looking forward to on how do we deal with that? How do we keep the African American community safe, even though we're so vulnerable and we're so nervous? We know that we're vulnerable. We know we suffer from chronic diseases and that we're apt to get this virus, but we have to do what we have to do.
Yeah, absolutely. And as you're talking, Angela, I'm just sitting here, you mentioned words like, how do we stay safe, but yet we're so vulnerable. It just puts us between a rock and a hard place. I mean, this COVID-19 has really exposed just some of our, that we're very impenetrable, right? As a African-American community. And I think for years, maybe we thought that we weren't. Dr. Hill, 100 years ago, we had the Spanish influenza. Over 1 million people died. Social distancing lasted all of 2 weeks. We've gotten smarter with that now, 100 years later. But do you feel as if we're moving back into some of those sad realities, or do you feel as if we're starting to get ahead of it a little bit better than maybe 100 years ago?
That's a good question. I was thinking the exact same thing because, we've been here before. And 100 years ago, based on some of my reading, some believe we were in a better position back then when men like W.E.B. Du Bois had to deal with this very same issue. And from what I'm reading, back then, we had more systems in place where we could take care of ourselves better. We might have had a stronger National Medical Association and other community-based providers to help get us through this situation. So I don't think we're better. I think we're really seeing the inequities that have been on our shoulders for so long being exploited. And when you look at not just medical, but the economics of what's going on here, a lot of times in the perfect world, we would stay home. But as you mentioned earlier, we're talking about trillions of dollars already being put forth to help prop up this economy, which can't afford to just have an open-ended check. And as a result, we're being put out there. And I think when you listen clearly to the words of leadership in this country, this is a trade-off of some lives for getting our economy back. So there is a trade-off. Otherwise, we would be home and pretty much taking it easy right now and being safe, but we got to go out there and work. So I think we're in a very vulnerable situation. And keep in mind, the wild card here, in my opinion, is we don't have the energy and the resources of our federal government to really help us out in a sustained fashion. That's been a huge challenge right now.
Yeah. You mentioned inequities, and so we didn't have the technology then that we have now, and we didn't have a way for us to track how many of the races were dying on a daily basis, right? You could probably see it by class 100 years ago.
Right.
You really couldn't see it aggregated by race the way that you can now.
Right.
But as you mentioned inequities, I read something earlier that said these problems have been going on for a long time. You're right, over 100 years. But it seems like a lot of people are very surprised by this. It's not because of race necessarily, is what I'm reading, that the virus is not just going after Black people, but Black people are being affected the most. This article goes on to say it's because of structural inequities that have led to poor health and greater exposure to the virus. Now, I know that we can't change these structural inequities overnight, But Angela and then Dr. Hill, as healthcare professionals, what should the Black community begin doing to address some of these structural inequities that exist?
Well, for me, some of these things, they can help quickly. Housing. If you have a home and you have multiple families living in a home, just think of some of the policies and processes that are out there. If you're a felon or you have a record or you have some of those issues, you can't get a home or you can't have a voucher. They need to give out vouchers now for persons to go and get a home. Let's talk about even financing homes. Persons can't rent in certain districts right now if they don't have the right income. Mm-hmm. But if you have 4 or 5 persons living in the same house, it's going to be hard to stop the virus. And so if you really want to put your money where your mouth is and really help versus putting billions of dollars in one direction, that's something that can help. One of the things, and for us at the Health Center, I started a foundation. And the foundation job was to help with some of these social determinants of health, housing, transportation, but we're building a new health center to help fight with COVID. As Dr. Hill and I was talking about, we had to shut down our health center, our dental department, and we know that dental services is really huge for especially African-American communities. It's part of that, your health. And so in the new health center, the goal is to actually build facilities where we can bring those services on the inside. Can you imagine if we're fighting COVID in the middle of winter and we have to have persons tested on the outside? And so fighting some of those things right now so that we can bring persons inside of the health centers. And for us, we call it the wellness campus model. We have housing surrounding around our health center. Some of the other things that can really help with essential workers and people who really don't want to have this conversation, but I'm fighting for my employees to stay on the front line. And the number one thing that they complain about is, why is it that if you're unemployed, you get an additional $600 from being unemployed and not have a hazard pay or something like that, so you can continue to work and use that hazard pay and maybe pay somebody else to come in and babysit your child. For example, I'm not sure if y'all are familiar with a program where the federal government reimbursed family members to stay with their senior citizens. Maybe they should reimburse family members to keep small children. Maybe they should pay for the niece to keep the small child so that the another family member can work. So some of those things they can do to help us or help our communities to move forward and to stay safe. And the other thing, the suppliers, masks, we may laugh about this sometimes and we may look at it and say, why don't they have a clean mask? Why do they have on a mask that you can clearly see they've been wearing 2 to 3 days? Why not just give out free masks so that people can be safe versus commercializing it and making persons pay for it? You know everybody need a mask. Just give it to them. They may not be able to afford the mask. And so those are some of the things that we can do. And we don't have to wait on huge structural changes. That's just Angela's spiel on that. But I think those are some things that will help the community.
No, I like that. And I'm glad you made that declarative statement, because when this is posted to YouTube and people across the globe are listening to this, they need to think about that, Angela. They need to think about, if you have a house in a cupboard and you've got 15, 20 masks, right? And you're passing people every day without masks, why are you not handing out masks, right? So that we need to be in a better practice about that. I'm glad you mentioned that. Dr. Hill, what about you? What things did you want to share?
I really want to get back to the stuff we always talk about. We've got to have stronger communities with institutions that are supported by us and for us. We need to have small businesses being supported by our communities so that they can be sustainable, because they're the economic engine of keeping that dollar in our communities and stimulating the economics of what is so very important. And we got to realize, once again, that everyone needs to be involved in our community. We've got to be involved in the voting process. We've got to have the right politicians in there creating the right policies, which is what Angela was really talking about. We've got to have policies that reflect the constituents of our communities and what their needs are. Childcare, better education, better jobs, better benefits. Because if you think about it, part of what we're talking about here are benefits, because if you had a job that pretty much said if you could sit home during this time period and be paid a little bit more indefinitely, this is a moot conversation, because then, you know, you're not talking about paying bills while you're sitting home and you're more in a safe environment. And we got to remember the importance of our community organizations, our churches, our NAACPs, our Pan-Hellenic organizations. We need to have systems in place that can address these issues and be able to be proactive instead of reactive. Right now, we're reactive, and that's very difficult. And finally, what I'm seeing in my office, and I saw this very early, is we have to realize we need to have relationships with our healthcare systems. You just can't pop up like it's an urgent care or a drive-through with complaints. When that doctor or whoever knows you and understands your needs, the telemedicine format that many of us are doing now is even more valuable, because through that computer, you can look at that individual's face, and when they say something and they look a certain way, you're going to know more than just what the words say. You're going to understand body language because of relationships. And clearly, we don't have enough Black physicians and healthcare providers, but we need to be working on that. And while we do that, we've got to make sure there's some real relationships coming out of maybe some sensitivity trainings for those of us who may not have minority providers that we're comfortable with. I think a lot of the challenges we're seeing now are because many people don't have relationships, and it's kind of hard to try to run in to get help now. And when you need to be able to trust somebody and there's no relationship when someone's trying to give you advice, you can imagine what's going to happen when a vaccine comes around, because I've already had this conversation. People are already anti-vaccinations, and if you don't have a relationship with someone who's trying to show you and tell you the risk and benefits of getting it, you've already made your decision based on what your girlfriend told you or what something on the internet told you. So, you know, we got to understand that that relationship is important. It makes a difference between life and death.
I asked Angela this question earlier, Dr. Hill, and I want to pose it to you. Do you see the cases and the deaths in the Black community getting worse? I think that we thought, let's get into the summer. This is these myths that I'm hearing, these myth busters. Let's get to the summer. It's hot. It'll be okay. We'll go back to normal. But it seems to be the opposite. We're already in almost the middle of July, and things seem to be getting worse. And so if you see it getting worse, how can we, aside from the things you and Angela mentioned earlier, how can we get ahead? Because both of you are saying be proactive, right? But I just want to be clear before we get off the call tonight, what that means for the community to be proactive.
Keep your pants on.
Well, to answer your first part of your question, unfortunately, I think it will get worse, because we already know it's getting worse, because we can look at the incline exponentially of cases developing. And we know that there's a 20% rule. 20% of people who get this, from what I'm hearing, will have to go to the hospital because they'll be sick enough. And another 20% of that group will die. And 80% of people who are on the ventilator, many of those people will wind up passing away. So that's number one. I think it will get worse. When you have a flu or cold, most of us do what? We stick it out at home and we tough it out. With this particular virus, you really can't do that. And if you do it, you've got to be very sensitive to if you get any degree of shortness of breath. Because if you remember, early on in this issue, a lot of people were dying in their homes. And many of us now are believing this is what was happening. And there was a case, for example, of a nurse in Detroit who went to the ER 5 times. She went, they sent her home. Remember, If you go to the ER, they really have one question to answer when you go there. And that question for the most part is, are you going back home to get better on your own? Or am I keeping you here in the hospital to possibly put a tube down your throat? So a lot of times you're going to go back home. And when you go home, the truth is you're not supposed to do it by yourself. If you have that relationship with a doctor, you either go into their office or you're doing a telemedicine visit, and you can kind of coordinate through the computer about managing you. So, and that gets back to relationships and paying attention, but that's the big difference here. What happens, most people are passing away because of pulmonary issues, and we got to be aware of that.
Yeah, I appreciate that medical lesson. Pulmonary issue, I didn't know that, and I feel like I need to schedule an appointment soon. If you were listening tonight, or if you're going to listen here in the next couple of days, I do hope that you take into strong consideration what Angela and Dr. Hill shared tonight. We did hear about systems being in place. We heard about relationships. We heard about being ahead of this disease by social distancing, wearing masks, washing hands often. Yes, hand sanitizer is good, but it doesn't replace, as I heard you say, Dr. Hill, 3 to 5 minutes under warm or hot water. And I even have to tell myself, 60 seconds because I'm in a rush, I'm thinking that my hands are clean, but they're not, right? It's really spending that time washing your hands and being very cognizant of the places you go and the things that you're touching. Okay, good. That's good to know. Grateful to you both for sharing. Dr. Hill, I have you put your information in the chat box. Angela, thank you for sharing your information. For those who are still listening, please join us on Thursday. We're going to do a part 2 of this COVID-19, its crushing impact on the Black community. On Thursday, we do want to talk about some of the data that is out. We do have a guru, an expert, a data specialist who's going to join us on Thursday and talk about the data across the nation, but in specific cities that are heavily Black populated, and what that data suggests and the trends moving forward. So please join us on Thursday. Angela, Dr. Hill, it has been a pleasure. Thank you both for coming on tonight.